Assalamualaikum warahmatullahi wabarakatuh. In this group, we want to talk and discuss about depression. And the group member is Syalfa Arvitri and me, Rizky Aisyah Pratwi. There's Nur Fadillah and Amara Paramita and Sherin Natasya and Marini Chua.
Hello, my name is Syalfa. Here I will explain what depression is and the definition of depression. What is depression? One, a very common, highly treatable medical illness. Two, affect physical, mental, and emotional well-being. Three, affect basic of everyday activities like eating and sleeping. 4. Affect how people think about things and feel about themselves. 5. In contrast to normal emotional experience of sadness, loss, or passing mood states, clinical depression is persistent and can interfere significantly with an individual's ability to function. 6. Give up latency. 7. Symptoms can last months or even years. Definition of depression is a common mental disorder, depression with depressed mood, loss of interest or pleasure, feeling of guilt or low self-worth, disturbed sleep or appetite, low energy, and poor concentration.
Okay, I will talk about symptoms of depression. There are a lot signs of depression, but you may not have all of them. How intense they are and how long they last are different from person to person. Okay, let's go to the symptoms of depression. Number 1, we have feeling sad, blue, or down in the dumps. Number 2, lose in interest in things you usually enjoy. Number 3, feeling slowed down or restless. Number 4, having trouble sleeping or sleeping too much. Number 5, less of energy or feeling tired all the time. Number 6, having an increase or decrease in appetite or weight. Number 7, having trouble thinking, concentrating, remembering, or making decisions. Number 8, feeling worthless or guilty. Number 9, having thought of death or suicide. Number 10, people with major depression experience at least 5 of these symptoms all day, nearly every day for at least 2 weeks. And the end is the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of function. Okay, that's it. Thank you.
Hello, my name is Nur Fadillah. I will explain cause of depression. There are 3 causes. This one, run is families. However, depression can also occur in people who have no family history. These 2, environmental, a serious loss, difficult relationship, financial problem, or even desired change in life pattern can trigger a depression episode. These 3, physical illness, serious complications such as cancer, some disorder, Cushing syndrome.
I will talk about forms of depression. First, major depression. At least 5 of 9 symptoms of depression present, including either loss of interest and pleasure or depressive mood. Symptoms interfere with daily functioning. Second, minor depression. Fewer symptoms than major with significant disability, shorter duration than chronic depression. Third, bipolar disorder, cycling mood changes with severe highs mania and severe lows depression. Okay, last is dysthymia. Dysthymia is a low-grade chronic of depression that lasts for a minimum of 2 years.
Depression can suddenly happen to anyone, so
Who is at risk for depression? First is old adults, second is young adults. Both of young adults and old adults, of course, they have their own ways of doing something like work, romance, and so on. However, if you experience problems that cannot be controlled and continue to think about without being resolved, it can result in depression. And lastly, who may experience depression is women, pregnant, and postpartum women. Women report depression about twice as often as men. This may result from a greater likelihood to discuss a depression or to seek help. Then, after knowing who is at risk for depression, of course, we need to know additional risk factors for depression. First is family or personal history of depression. Second is current substance abuse problem. For example, is abusing alcohol or illegal drugs. Third, a major life stressor or change in life events. For example, is loss of a loved one or a job. And lastly, chronic disease. For example, is suffering from a serious disease such as thyroid hormone disorders, head injury, diabetes, and others.
Now, I'm gonna explain what is the risk factor of depression. Although the exposure to risk factor changes across the lifespan, the relative risk associating them to depression remains similar for most risk factors. Most specific risk factor is low income, healthy factor pain, MI, and number of chronic diseases. However, seems more strongly associated in which occurrence is slowest and least expected. There also another risk factor, like number 1 is genetic. Genetic is from history of depression in your family. Number 2, death or loss. The sadness that you have losing the someone you love make you very stressed and can be serious symptom of depression. Number 3 is conflict. Maybe you have personal conflict with your family or friends that may lead you to the depression. Number 4 is abuse. Past physical, sexual, or emotional abuse can bring it on as well. Number 5 is life event. Another chance that can do that include a new job, loss of employment, marriage, divorce, retirement, having a baby. There are also another illness that make you depression. Example like sleep problem, chronic pain, anxiety, ADHD. There are also excessive guilt almost every day. Number 8, problem with concentration or making decision almost every day. Number 9, recurring thought of death or suicide plan or suicide attempt. There are also physical signs of depression. Signs of depression may include the following. Number 1 is appearance of preoccupation. Number 2, lack of the eye contact. Number 3, memory loss, poor condition, and number 4, packing, hand wringing, and pulling on hair. Number 5, psychomotor retardation or agitation, such as slow speech, sign, and long pause. Number 6, self-deprecatory manner and deviation, especially in adults. Number 7 is slow body movement, even to the extent being motionlessness or catatonic. Number 8, fearfulness or sad coordinated. Now I'm gonna explain about depression treatment. Depression treatments is therapy, meditation, self-help. If you are confused by the all different treatment options for depression, here how to decide the best approach for you. Number 1 is finding the best depression treatment for you. How can you know the best treatment for you? Number 1, learn as much as you can. Isolation to another illness or separate of your family or social group can lead to the depression. After we understand what is factor risks of depression, now I'm gonna explain how the doctor look for to make a depression diagnosis. A doctor can rule out another condition that may cause depression with the physical examination, personal interview, and last test. The doctor will also conduct a complete diagnosis evaluation, discussing any family history of depression or another mental illness. Your doctor will evaluate your symptoms, including how long you had them, when they start, and how they were treated. The doctor will ask questions about way you feel, including whether you have any symptoms or depression, such as the following. Number 1, sadness or depressed mood most of the day or almost every day. Number 2, loss of enjoyment in things that were once pleasurable. Number 3, major change in weight, gain or lost weight. Number 4, insomnia or excessive sleep almost every day. Number 5, physical redness or sense of being ruled down that noticeable by another. Number 6, fatigue or loss of energy almost every day. Number 8, whether your depression symptoms are due to underlying medical condition. If so, that condition will need to treat first. The severity of your depression is also a factor. The more severe the depression, the more intensive the treatment you like to need. Number 2, you can take time to find the right treatment. It might be take some trial and error to find the treatment and support that works best for you. For example, if you decide to pursue therapy, it may take a few attempts to find therapists that you really click with. Or you may try antidepressant, only to find that you don't need it if you take daily half-hour walk. Become to change a little experimentation. Number 3, don't rely your meditation alone. Although the meditation can relieve the symptom of depression, it's not usually suitable for long-term use. Another treatment, including exercise and therapy, can be just as effective as medication, often even more so. But you don't come with unwanted side effects. If you do decide to medication, remember to medication works best for you when you make healthy lifestyle change as well. Number 4 is get social support.